Hello, we're with FSCDR TV. We're here with Warriors Within, and I'm here with Danielle. How are you?
I'm doing good. How are you?
Welcome. I'm happy to have you.
I'm excited to be here.
Thank you. Well, listen. So, we are here to just dive into being a sickle cell warrior as Jamaican. Yeah, let's dive into this topic because a lot of times they think that sickle cell warriors are just, I guess I want to say within United States, maybe probably Africa. They don't think about Jamaica, Haiti, Dominican Republic, or any other outstanding countries that surround us or anything like that. So I want to just go full in. How is it being a Jamaican girl with sickle cell? Is your family knowledgeable of it? Because as I'm American, and as American, we don't think of third world countries having all the access and the needs to provide to people like that. So how is that?
So I guess how I would say it's a lot of herbal medicine that Jamaicans like to deal with.
Teas.
Yes, literally teas, fruits, vegetables. Anything that you can really think of that's natural medicine is how we like to deal with it. Like up until I was 17 years old, I never had any narcotics to help me with my pain. Even though I live in America and I've been going to the hospital since 6 months.
Wow.
You know?
Okay.
Yeah. So it was very difficult, but I'm thankful the way that my mom, made me grow up with having sickle cell and not taking any narcotics until I was 17 years old. I had morphine for the first time when I was 17, and it actually definitely helped. But I am grateful that I didn't get strong narcotics since that age because addiction is very prominent in the sickle cell community and just with a lot of diseases overall. But, yeah, I guess, like, that is something that was, like, very, what's the word I say? Like, very strongly, like, thought about. And my mom really did not want me to start any type of narcotics until I was of a certain age.
Okay, so that's really good. I do oppose because I understand that they give a lot of times they give a lot of sickle cell patients real hard drugs and it affects you later on down life. So now I have questions. As we talked before, your mom doesn't have sickle cell? She doesn't have the trait?
No.
At all?
Well, she does have the trait, but she doesn't have sickle cell, and they did not know that they had the trait until they had me, and they told her that at 6 months I had sickle cell.
And then so when she found out at 6 months, she brought you to the hospital, and then this is where she proceeded. Now I want to know how hard did you ask your mom how hard it was for her going against the grain of not wanting to let you follow the protocols? Because the first thing they ask for you to do as a sickle cell patient is follow these protocols. We need to put you on this medication. You need to start taking this. You got to take this for pain. Take this and this and this. And you just said that you didn't start taking medication until you're 17. That's really hard considering the fact your pain levels go irate. You're not taking anything. So that means you took a lot of the herbal routes.
Definitely
of just being
a lot of the herbal routes, a lot of massages, sleep therapy. I don't know. Well, that's what my mom calls it. Sleep therapy.
You gotta.
I don't think that's a real thing.
It's true. I get where she coming from. You gotta hydrate. You gotta hydrate and sleep your body to make it come back to life. So so a lot of sleep, a lot of teas, a lot of herbal.
And it's not that I didn't take any medicine though. It was just not the strong narcotics that most sicklers would take at a young age. So a lot of Tylenol, Motrin. I did also take I don't really remember exactly what it was called when I was younger, the treatment that they had me on. But I think it was penicillin and a lot of Tylenol. The most that I did take, I think, was Tylenol with codeine.
Okay.
So,
That's usually like a basic one that they kind of start you off with when you're younger. Yeah. So how did your parents grow awareness to this? Like now I can only imagine your parents got together, and if I'm understanding, both of your parents are Jamaican descent, right? So they come from a country that probably has knowledge of sickle cell. Can you elaborate on is sickle cell very knowledgeable in Jamaica? Is it aware? Is it a big thing?
So what I'm going to say, I don't believe that it is a big thing, but that's just from my experience. I've been to Jamaica, but I haven't been to Jamaica enough for me to say fully that they aren't knowledgeable about sickle cell. Mm-hmm. But what I would say is the recent time that I did go to Jamaica, this is the first time like I'm actually aware in Jamaica. I asked my family, and I was like, so what would happen if I did have a crisis in Jamaica? They were like, well, we're not going to take you to this hospital as we're passing the airport. We're going to my aunt's house. And not take you to this hospital, but we'll have to take you farther away. Mm-hmm. So I'm just thinking, like, wow, that's
and did you ask the distance of
hours?
These houses? Yeah, I was gonna say. Yeah, I was gonna say that because they're not like 30 minutes away like how we think they are.
Not at all. So I'm like, maybe by the time I get there, I don't.
Yeah, I hope I'm making it.
Yeah, you know what I'm saying. So it's just, it is crazy. My little cousin, she was telling me how her friend has sickle cell, but she doesn't experience a lot of pain crises as I do. Mm-hmm. So I was thinking, like, you know, she probably doesn't even know what type of sickle cell she has, you know? So I don't necessarily think that there is the same amount of knowledge that we as Americans have about sickle cell than, you know, Jamaicans in Jamaica. But as far as, like, when I was growing up, my mom, she really did not know a lot. She had to educate herself about it. Like, there was no one for her to really speak to about, like, what should she do besides the people that she met at the hospital, you know? So it was difficult for her, like, still as of now. She really didn't see up until when I was 18 sickle cell as a disability. Well, she knew that it was a disability, but she didn't see it the way that other people would see sickle cell as a disability, so she did not immediately apply for disability, you know, for me. So I'm still going through that process now, trying to get that. And because of that, I feel like it's a lot harder to get into the system. You know what I'm saying?
Yeah, I do. I understand completely. I do. Because, like, as talking to one of the warriors before, those are certain things that's not really knowledgeable at hand to sickle cell patients at all or warriors at all, that they don't understand that these are little advocate things, as I said, as in Social Security. You guys are deserving of this. Like, you know what I'm saying? The same way as other patients and people that have, like we said, lupus, cancer, and everything else, they have things that are deserving to them. Yeah. So I want to dive into this aspect because I do agree with you. I've been to Jamaica a couple times, and that was kind of my first question about sickle cell, because they did make it very knowing that it is they have it commonly over there. Where do you see as in making awareness? Because I believe awareness needs to be spread all over the board. This is something that our people, and not just our people here in the United States, as we know, like I said, in the other countries, they face as well. Where do you think where we could help as sickle cell advocates make more awareness to help in the country of Jamaica, to make them more aware, to help out their sicklers? Because I can only imagine how hard it is. You got to drive 3 hours to get to a hospital. Then let's not talk about it. If you already reached that hospital and your pain is at a 10, God, you just sitting there just in excruciating pain until they wheel you in the back, and then wait to be seen. And then we don't even know about that part, because we not from there, so we don't even know what it's like to wait to be seen, to see a doctor, to even get the IVs to administer. So how do you think that we can make awareness in another country?
So what I would say, I mean, at the age that I am at right now, I use social media a lot. So I would say first, maybe start with social media and get in contact with sicklers that, you know, are in foreign countries like Jamaica, you know, and start speaking with them. I do have a lot of followers that I know that do have sickle cell that actually live in Jamaica, but I haven't gotten in contact with them, you know, to really see what's going on. But I would say definitely that would be a place that you could start, that we could start, you know.
For sure. And did you feel like in Jamaica, because it's not, sickle cell isn't like a big like I'm not going to say big advocacy, it's known, but do you feel like they prefer more of a holistic way opposed to actual going the treatment place that we go about?
Yeah, I would definitely feel like that, because just already with my family members and the fact that they know that I have sickle cell, it's something that I hear a lot with them. They always
Yeah.
are making sure, like, make sure you drink water because we don't, we don't want to have to go this route, or we don't want to have to do this. Make sure you're drinking ginger. Make sure you're drinking aloe. I'm going to make some aloe juice for you.
So they probably make you drink all those concoctions that they tell you with the turmerics and the ginger.
And then when I actually, get a little pain, they're like, surprise, oh, I thought, I gave you this. It should work. It should help. But that's not everything,
So how do you go about
everything?
when we were talking, you said you were the youngest out of how many siblings?
So I'm the second youngest on my dad's side out of 11 siblings.
Okay.
And then I'm the the third youngest out of 4 siblings on my mom's side. But altogether, I have 11 siblings.
Okay. And how is the support and from your family? Like, do they understand? Do they have full awareness? Do they advocate for you?
So I would say that the most person in my family that does advocate for me is my mom.
Okay.
Everyone else, they're not very aware of sickle cell disease. They just know that I have it, and they are there for me. I definitely say they are there for me, but sometimes it's not in the way that I would need.
Yeah.
I don't think they go and take enough time on their own to research what sickle cell is and how it affects me.
Yeah, because that's usually something that you have to do. You have to take your time to educate. So if they don't understand, you have to take your time to educate them to what's around you. Mm-hmm. So as in for your mom, being a person from the third world country, I'm pretty sure, like you said, she had to learn all this stuff on her own. Mm-hmm. Did she have any understanding from your grandparents? Did your no? They didn't explain none of that?
My grandparents died when I was really young. So they did not know enough about sickle cell. They didn't know anything about sickle cell, to be quite honest, until my mom had me, and she educated them, and she had to educate her family on sickle cell. Obviously, some of them knew, what sickle cell was, but not as much as
every other
parent. Yeah.
So how was it with going to school then? Was it hard? Was it difficult? What adversities did you really face?
So going to school, elementary school, it wasn't too bad, to be quite honest. I don't really remember going to the hospital as frequent. I did know that I was different, though, when I was in school. And I would feel pain. I just knew the way that my teachers treated me. When we would go outside, they would make sure that, make sure you're drinking your water, and make sure you're on this side, don't play too much, things like that. I didn't really feel a difference with having sickle cell until I was in high school. Because high school was just really hard. I struggled a lot, like, with going to the hospital and keeping up with my work. So that was really the only thing that kind of made a big difference, with having sickle cell.
How do you go about your mental health with it? Because, again, from talking to my previous warriors, mental health is a big thing that is not talked about with sickle cell warriors.
Yeah.
I feel like you guys just kind of cope out. Like I said before, y'all cope in silence. Y'all will isolate yourself if you don't feel like talking. If you don't feel like talking, being bothered, if you aren't feeling well, you will isolate yourself. So how do you deal with it?
So I guess I've started dealing with it in a more healthy way recently, I would say. But before, I definitely would isolate myself. I wouldn't really let people know, like, what's going on with me, because I didn't really know too much or think that it was affecting me. I just thought that, I have sickle cell. It is what it is. It's just what I have to do.
Was it hard for you making friends in high school and stuff like that? Like, did were anybody understanding?
So it really wasn't hard for me to make friends, but it was hard for me to keep friends. That's what I would say. Okay. I felt like me not wanting to hang out and do certain things because of the fact that I have sickle cell, some of the people weren't very understanding when I would have to isolate myself, or I can't go this way, or I'm not able to sleep over their house. Like, my mom was very strict about me sleeping over people's houses because their parents don't know, you know what I'm saying? And then in order for her to have to talk to them, some parents don't want to do that, and that was, a big thing. My mom didn't play with that.
Of course.
So, yeah, I would just say, like, as far as, like, keeping friends in the long run, that's how it would affect me.
So how do you think your support is with having sickle cell? Do you feel like it could be better? It could be more? It could you have a fair support system?
I definitely feel like it could be better. You know what I'm saying? Like, the person that I really have to support me is my mom. Like, that's really what I would say. More so recently, my little sister, but she has autism, so it's hard sometimes for me to talk to her, and vocalize, you know, how I'm feeling, but she tries her best. We live together, so, you know, now she's been trying her best to understand where I'm coming from and understand that I do have sickle cell and I have certain things that I have to do differently. You know what I'm saying? So, yeah, I would just say, like, you know, I can talk to my siblings about doing more, but sometimes I just don't want to burden people.
Yeah, I was going to say you probably feel more of like it's like a burden to kind of bother somebody. Which is, I want to let you know, as a parent, it's not. It's not at all. No, nothing you can say when you're going through what you're going through is a burden at all. Because if you're, as a family member, we don't want to see you like that. So that is not a burden at all. To piggyback off of this, so how is your love life? Because that is, again, like I said, I like to go for mental. I like to know how your mental is. How is it if you're a really beautiful young lady? And in the day and age that we're in, you have to question, like, what is going on? Are you know, the sexually active questions. You have to ask these questions. So I can only imagine how weird it is for you at the moment in this day and age to have to ask questions. Hey, do you have a sickle cell trait, or are you sickle cell anemic? Because you can't really engage with them like that. You can't even if you like them fully, you can't even put your mind, or, you know what I'm saying, you can't even put yourself in that space to be fully open with them. So how has dating been for you?
So I would say from a young age, I've been very vocal about the fact that I do have sickle cell. So most of the people that are interested in me, they know that I have sickle cell. I make it very known, and I let them know, you know, what's going on. So I would say most of the times it's not very hard. I guess when it gets to the point where, like, you really are interested in someone and they're interested in you back, I kind of do tests to see if I feel like you are someone that deserves to be in my life, especially because of the fact that I do have sickle cell. I do have to make sure I set my standards differently, and just in general, like, move a certain way when it comes to being in love or being interested in someone. So yeah, I don't know. It's not difficult for me to have the conversation with them, to be quite honest. I just know that it's a priority to me, and if it's not a priority to them to go and get tested or just ask their parents, you know what I'm saying? Be aware of what's going on, because, you know, it's
serious.
Yeah,
it's serious.
It's not a joke.
It's not a joke.
Yeah, depending on how they react to that, that makes me know, like, you know, we shouldn't be involved, or we should be involved.
So my next big question, because I normally dive in on this one heavily. A lot of sickle cell patients and warriors, they always say that you get treated different from being in pediatrics to adults. And I'm going to ask on every sickle cell warrior, what is your experience? Can you explain, how is it different for you from going from peds to being adult?
It was so different. So different. From when I turned 17, I had to do the transcranial Doppler test.
So I'm going to pause you right there, because a lot of people don't get when we're going to say some terms that is going to fly over people's head. Okay. They're not going to understand transcranial Doppler is for you to actually get an ultrasound of your head to understand that your blood flow is flowing the correct way. Just have to drop that there for you guys. Continue, my love.
No problem. Sorry about that. But yeah, so I got the scan on my brain and things were not doing good. So I had to get blood transfusions every month up until I turned 18. So going to the hospital every month, and I guess having the nurses really care about me and be around me to once I turn 18, stop getting the treatments. Then I have to go to adulthood. It was very, very crazy. Like, me going to the hospital was very strange. I don't know. I don't know. It's just very hard. Like, I don't know what happened. Like, they just feel like you don't have sickle cell anymore or you're not that critical. I don't know. I don't know.
You don't feel like they're that attentive as there would be to, which is common. I hear this often with a lot of adults that, when they always tell me my son, like, yo, enjoy it while your son's in peds right now, because when he gets to adult, it's different. Yeah. And I feel like that's really hurtful to say, because you're sitting there pressing the same button he's pressing in a whole nother hospital, like adjacent from each other. Like, that's really wild, that the fact that you won't get the same attention that somebody that's literally probably a couple years younger than you, that's getting that attention. So I guess my next question would be for you is, where do you feel like they could implement better healthcare for that?
I guess I would say, like, as far as to, like, doctors and nurses, like, they need to go through a course again, to be honest. Like, a
niceness course to understand, like, and I get it.
They need to actually educate themselves on sickle cell, because a lot of them, let me not say them, a lot of nurses and doctors, I feel like, first of all, once they get through a certain course or whatever it is that they get to be a medical provider, they've already learned so much, so they don't know enough about sickle cell, and they don't go back to refresh their minds or anything like that before they start treating patients. I can understand that. So I feel like they need to, within their community, talk to one another about how they treat other people, like treat adults with sickle cell. I don't know.
No, I agree with you, because it is hard. And I think it's hard to understand as a patient when you're in the hospital that is one nurse to like 5 sickle cell kids, and it's hard for them to try to make, like, you have one that's saying my pain is at a 6, the next one saying my pain is at a 10, the next one saying my pain is maybe like a 2, the other one saying my pain is like at a 4, and I think they kind of get frustrated with it too, but they don't understand that the frustration you're in, like, I'm in deeper need than you are right now, and I totally get that. So as far as in, like, when we talk about community, where have you found your community? Like, where have you found your support? And when you're feeling down and you see where you go to for your help, to just get your empowerment to get lifted up?
So I'm not going to lie, to be very honest with you, I did not necessarily feel like I had a community until I started going to the sickle cell clinic. Mm-hmm. And that was in 2021. One of my friends that is my sister's friend, and she became my friend because she has sickle cell, she introduced me to the sickle cell clinic, and she kept telling me about it, but obviously I was scared. I didn't know at all. And from then, me going to the sickle cell clinic, I've met a lot of sicklers that we talk. They help. Whenever you're going through a rough time, you text them. Even when you're in the hospital, you guys would be in the hospital at the same time. Yeah.
That's the crazy part.
Yeah, it is very crazy. And that helps a lot, to be very honest with you.
So, where do you see, like, a positive advocacy for sickle cell? Do you see a change? Do you see a betterment? Where could we as the people gear this to be more, to help, to expand the growth of helping?
Just say educating others and educating yourself. I feel like once you know, then you can actually start to do and help others. And even if it's just to be a ear to listen, you know what I'm saying? I feel like that's a big thing. And just,
have you ever thought about being, or not even being, or just advocating or speaking to younger kids that have sickle cell younger than you?
Yeah, I've thought about it. I have a TikTok account, and I do, like, the process of me getting my treatment, things like that, like going to the doctor and stuff. And there's a lot of younger sicklers that are prominent on my page, and I talk to them, they talk to me, and it feels good. You know what I'm saying? So I could imagine like doing it at a larger scale, that would be amazing.
Yeah, because you're making awareness not just for yourself. You're making awareness that this isn't just my life. This is what other people like me go through as well. And it makes others feel way comfortable knowing. I get it. You feel a lot more better when you know somebody like you have somebody like me, if we're the same. So I totally get it. So then let's go back to you. Let's go back to your country. Let's go back to Jamaica real quick. How about, you still have family there, right? Do you have any cousins? And I remember you saying this. You have cousins that have sickle cell there.
No.
No? Okay. So have you got to talk to your family about how they live in Jamaica with sickle cell?
No, I actually haven't talked to anyone in Jamaica to see, like, you know, how they do live with sickle cell. The only other person that I do know that has sickle cell that lives in Jamaica is my friend on TikTok.
Okay.
You know, but we don't talk very often. It's just mostly like, you know, feel better. I'll talk to you soon. How you're doing? When you are in a rough patch, we'll talk. But as far as, like, you know, talking to a lot of Jamaicans and, you know, seeing how they deal with their sickle cell, I don't know personally another Jamaican that lives in Jamaica with sickle cell.
Got you. So how did your mom, because you said your mom has a trait, and she was I'm just backtracking with her. I'm a mom, so I'm walking through her process. She went through a holistic method with you. As a mother, knowing that she has a trait, did she ever have, like, look at you and be like, hey, I feel some of your pain? Because, you know, as a trait, we kind of feel what you feel in a sense, right? Yeah. So did she ever kind of empathize with you on that?
She did empathize with me. She empathizes with me a lot. But as far as, like, you know, her feeling the pain, she just, she hasn't told me that she has felt pain as far as having the trait. But when I'm in pain, she, you know, tells me that.
Yeah,
she feels my
feel
pain.
it.
You know what I'm saying? She knows.
Trust me, we do.
Yeah.
As a mom, we do.
My sisters, all of my siblings have the trait, you know. So 2 of my sisters have told me before that they feel pain, you know, in their joints, but they don't know enough about sickle cell to register it as they're having trait pain. You know what I'm saying?
Because it's a mild. I'm gonna be realistic with you. It's a mild feeling. It's not. I would never. How you tell me you go in pain, my pain is never the same as yours. I look at my son, and when he goes into a crisis, it's never the same. Like my back pain compared to his, totally two different things. Where do you feel that it could be more advocacy for our people? As in, where could we dive in more? Because as you tell me your personal experience, I do agree with you. There needs to be a lot more compassion and a lot more attentiveness. So if you could make more awareness, or you could chime together, what would you do?
Okay, so I guess where I would start is by making and studying the different types of sickle cell more, because I feel like not a lot of people know that there are different types of sickle cell. I didn't know that until I turned 18, you know, and I'm 24. So
Yeah.
That's crazy. But as far as, like, me wanting to advocate more, I would say I like advocating a lot through social media. And then once I do build a bigger crowd on social media, I'd like to start doing events. Just, you know, little things, I guess, help by, like, you know, I don't know.
Yeah, no, I get you. So how would you say that, you said that you found the center and through a friend. So how can you say that finding the center has helped you, have impacted you in a positive way?
So since I found the center, I've been going to the hospital way less. You know what I'm saying?
That's beautiful.
Yeah.
We're going to clap for that one.
And the type of experience that I do get by going to the center, when I do need to go to the hospital, it's not like they're looking at me a crazy way because I've been to the hospital this much in this month or these 6 months. You know what I'm saying? It's a better look, not only when you do go to the hospital, but you just feel better being surrounded by other sicklers.
Yeah.
You know, and you know that you all are going through the same thing. It's not really like you're getting treatment.
Yeah. Yeah.
It's like you're going to see your friends too.
Literally.
You know what I'm saying?
It's like a little clubhouse for you.
Exactly. So it doesn't necessarily feel like treatment, but it feels like a home, like community.
Do you feel like a center like this would serve a great purpose to be in countries like Jamaica?
Yeah, for sure.
Do you feel like this would be something to if a center like this was to open, like I said, in other countries around the world, it would provide more knowledge to them as well too?
It definitely would, because I like to travel a lot, but traveling with sickle cell is hard.
It's limited
sometimes because you don't know how you're going to feel, and you don't know if you do end up having a crisis, the treatment that you're going to get when you are in a different state. You know?
Yeah, different state, different country. Yeah, I totally agree with that. You get somewhere else and you get sick, that is the scariest thing.
It definitely is.
I can only imagine that. So, as being a Jamaican, because I know you're proud of it, you got your jacket on. What would you say that you would do, that you would want to do to better, and I guess I want to say better, your Jamaican sicklers?
I feel like in school they should teach you about sickle cell.
Okay, that's good too.
Yeah. When I went to Jamaica, I think when I was in 2016, we went for a mission. My grandma, she used to teach, she owned a school in country. So we handed out, like books, just gifts, little things for children, and we held like a little mission, So I feel like things like that, like I can figure out where the school is that my grandma made, and that way if it's still going on, because I'm not too sure if it is going on since we're in 2024, but if it is still being made, maybe we can talk with the people there, like about advocating for sickle cell in Jamaica, you know what I'm saying, and teach it in school, because I feel like it definitely needs to be learned about. They teach you about genes and stuff in school,
everything else.
So this is something big.
Yeah. No, agreed. Especially, like I said, in countries, and I agree for more so for smaller countries, because, like I said, they don't have the resources like we have here to really take care of the people in their country. So, I do agree with you. It would be beautiful once we get to the point to make awareness that these foundations and these centers aren't just here in the United States. They're literally everywhere. It will be so beautiful when that happens. So when we get to that time, because we're gonna get there eventually. I have a lot of faith and a lot of optimism about how far we can go. What is your outlook on how far us as a people can make sickle cell grow, awareness, community-wise, health-wise, school-wise? Because it doesn't just happen just in one aspect. Like I said, we go from mental health, school, home, family. It takes a village to make this work. So where do you feel like all this could tie in?
I feel like it starts with yourself, as being a sickler. It starts with you, and what I can say is that since I was younger, I have seen sickle cell advocacy grow so much already, and I'm only 24, so I can imagine what it's going to be when I'm 50, you know what I'm saying? So I feel like it definitely just starts with you, and I feel like I want a lot of sicklers to know and not to feel embarrassed of having sickle cell, because it's nothing to be ashamed of or embarrassed of. Like, it is what it is, you know what I'm saying? And you were made this way. Like, I try with myself to just let myself know, like, I am grateful that I do have sickle cell, to be very honest with you. I'm grateful that I have sickle cell because it has set me apart from certain people and from certain things, like just already how I live. So I just try to not look at it as a burden or as something that I should be ashamed of. You know what I'm saying? So I feel like it definitely does start within you. Like, once you get past that feeling of like, dang, this is very hard to deal with.
This
you know
my
what I'm
life.
saying? Yeah, exactly. Like, being ashamed that it's your life, or like being down. Like, don't let it get you down. I know it's enough when we're in the hospital and we're down.
Yeah.
But when you're just chilling, you know, and you're just thinking like, dang, I have this disease. It's, you know what I'm saying? Like, that can put you in a crippling mental state. So just try your best, you know, to stay positive. I don't know.
And how do you stay positive going through all this?
Music helps a lot when I'm in the hospital. Yeah.
Okay, so that's your outlet. So music is your outlet. Okay, I like to hear that. I like to hear that. I appreciate you for coming today. You have been more than knowledgeable. It was delightful having you, and I hope you come back in to FSCR with Warriors Within.
I will.
Thank you.
Thank you so much for having me.
No problem.